Welcome. Let's start with our first question. A client with head injury has a sudden increase in blood pressure and widening pulse pressure. What is the nurse's priority action? Now, consider your options. Is the answer A, reposition the client? Is it possible that it's B, administer antihypertensive? Perhaps C, notify the provider? Finally, D, decrease IV fluids. Time is up. The correct answer is notify the provider. Moving on to question number 2. A nurse notes a client's IV site is cool, pale, and swollen. What is the first action? Now, consider your options. Is the answer A, slow the infusion? Perhaps B, elevate the extremity? Perhaps C, discontinue the IV? Finally, D, apply warm compress. Time is up. The correct answer is discontinue the IV. Let's see the next one. A nurse is caring for a client receiving morphine IV. Which finding requires immediate intervention? Now, consider your options. Is the answer A, constipation? Is it possible that it's B, urinary retention? Maybe you think it's C, respiratory rate 10 per minute. Finally, D, nausea. Time is up. The correct answer is respiratory rate 10 per minute. Moving on to question number 4. A nurse enters a room and finds a client unresponsive and pulseless. What should the nurse do first? Now, consider your options. Is the answer A, call the provider? Maybe you think it's B, begin chest compressions? Or is it C, get the crash cart? Finally, D, check blood pressure. Time is up. The correct answer is begin chest compressions.